Chapter 5 Cultural Competence. No matter where you are in the country, you're going to deal with a wide variety of patients from a wide variety of diverse backgrounds. For me, I used to work at the Cleveland Clinic in organ transplant. It's actually one of the few places in the world that did intestinal transplants, meaning we'd have patients from all across the world, Asia, Middle East, Europe, coming for this very specific surgery. And each culture is going to have its own unique considerations. For culturally competent care is delivered when the nurses value health or illness experience through the patient's eyes, through the patient's expectations. You know, each culture is going to have its own unique requirements and expectations. And us as nurses, we need to find the best way to provide care. About 20% of the people in the United States speak a language other than English at home. And this has only been increasing in recent years. Diversity can create challenges, especially when cultures and language differ, especially when it comes to HCI and NCLEX. A big consideration to keep in mind if you have any hint of a language barrier, immediately get an interpreter. We want to have an interpreter that's as close in age and gender to the patient, and the interpreter should never be a family member either. We want that medical professional interpreter. Our big takeaway is if you're unsure, just ask the patient which they prefer. Some females of Middle Eastern descent would often prefer to have a female nurse. Other things would be considerations for diet. Ask if there's any dietary considerations, and just finding what will keep your patient the most comfortable. Covering down on a little bit of definitions. Culture is going to be all the socially transmitted behavioral patterns, arts, beliefs, knowledge, values, and customs that could influence the patient's worldview. Whereas ethnicity would be defined as a social group within that culture or social system. And this could include everything from language, history, lifestyle, religion, or all of the above. When understanding race is genetic in origin and includes physical characteristics such as skin color, bone structure, eye color, and hair color. All humans share a genetic code at greater than 99% identical. On the other hand, religion refers to the organized system of beliefs, rituals, and practices with which an individual participates. Spirituality, on the other hand, would be a more broad concept that include everything from prayer, meditation, walking in the woods, and listening to music, just to name a few examples. When discussing the importance of culturally and linguistically appropriate care, there are national standards to ensure equitable and effective treatment. They are organized around three themes: culturally competent care, language access services, and the organizational supports for cultural competence. When looking at the legal considerations, healthcare organizations should ensure that patients receive effective, understandable, and respectful care. Care provided is in a manner compatible with cultural health beliefs as well as practices and their preferred language. That preferred language you're going to see come up a lot, as well as the use of getting an interpreter to make sure that that patient is both understood by the healthcare team, but also that the patient can understand us. When dealing with culturally competent care, looks at the patient as a unique person by assessing their beliefs, values, preferences, and needs. There are five interrelated attributes of cultural competence. The first is cultural desire. The nurse must be motivated to become competent. Cultural awareness. The nurse begins their cultural awareness through an in depth self examination. The nurse knows the cultural knowledge. Begins when the nurse learns about the beliefs, religions, values, and customs of the different cultural groups they may be providing care for. Cultural skill would be the nurse demonstrates the relevant cultural data in a cultural based health assessment. And finally, cultural encounters, where the nurse provides opportunities to have interactions with a diverse background. Some wrapping up, some big takeaways are going to be don't stereotype your patient. Each patient's going to have their own unique requirements and considerations, and each patient will require a personalized assessment and a personalized care plan. When developing that template for assessment, Look at direct assessment of the patient's health beliefs, as well as practices that may reflect their cultural requirements. Provide a focused interview to include information about their personal beliefs. Include that in your handoff report to the next nurse. When dealing with personal and psychosocial questions, again, we'll begin with introductory questions like what cultural practices are important to you. Determine what their primary language is, what language is spoken in the home, and look further into their personal beliefs about their current health and illness. What are some practices you believe that will improve their health? Are there any dietary considerations that may be leading into this healthcare issue, such as vitamin A deficiency in cultures that eat a predominantly white rice-based diet? For other religious and spiritual influences, again, do they have any spiritual needs that'll be met? We need to find a chaplain or someone who's able to facilitate that. Find out their roles in the family, such as who makes the decisions. Those special dietary practices. Again, there's your hospital dietary department's going to have a whole checklist. They're going to be used to getting special requests and special religious diets. But we need to make sure that that's documented and caught early so we can begin to get those special meals prepared. And for our final slide as we wrap up, remember to be sensitive, but don't be afraid to ask questions. We don't want to assume that the care for one individual of a culture is going to be the same as for another individual of a culture. Each patient's going to need their own unique care plan and treatment plan and have their own unique requirements while they're in your care. But anyway, I hope this was a good review for you. And otherwise, that's all I got. I'll see you in the next slides.